Hello. So forgive me if this is a little bit awkward. This is the first time I've done a live Facebook lecture before. Could I just have somebody in the team in the private chat tell me that everyone can hear me and I can continue? Ah, beautiful. Okay, great. I'm going to present my slides now. I believe somebody helps me do that, or maybe I do it. Ah, gorgeous. Ah, thank you so much. You guys are a great team. Okay, so just so I know that I'm not by myself here, I want to give you guys a bit of context of where I am right now. I'm in Cape Town in South Africa for a conference about dementia and brain health, which is what this lecture is about as well. So I know other people are here. Can I see in the chat where you're coming in from? So where are you located in the world? It will help me guide what this conversation will be like. And at the beginning, it will be a one-sided conversation of me yammering away about dementia and brain health, which is a topic I care very much about. But for everybody else, you can ask questions either using the Slido and ask them anonymously, or you can ask them in the comment section. Oh, wow. I just clicked the comments and I can see where everybody's coming from. That's amazing. Thank you so much for joining in. Ah, you're in Spain. Okay, England. Wonderful. I'm originally from Vancouver Island in Canada, but I've lived in the UK for the last many years. Pleasure to meet everybody. Ah, terrific. Okay. Now, let's continue with the slides. Let's stop doing the introduction. So the lecture today, or the conversation today, we're going to talk about what is dementia. So a little bit of a background about biologically, what is dementia? What does dementia look like? What are its various forms? Then we're going to talk about living with dementia. I'm not living with dementia, but a lot of my really good friends are living with dementia. So it's a nice way to talk about, like, look, this is what dementia is biologically. This is what it's like, or it has been explained to be like, to live with dementia. And then we're going to talk about preventing dementia. So what can be done to reduce your risk of dementia? When we talk about dementia prevention, it depends what research circles you're in, but usually you wouldn't say preventing dementia, you would say reduce your risk, because you can't fully prevent dementia, not yet. We don't have the medical knowledge to do that. And we also don't want to put ownership or blame on somebody who's currently living with dementia. Yeah, 100%. You can ask me questions anytime you want. And again, my apologies if it's a little clunky doing this online Facebook. Yeah, it's a new thing. Okay, and then at the end, we're going to talk about brain health research, and then we're going to talk about getting involved in research and a project I'm leading called the Next Generation Brain Health Study, which I'm co-leading with my dear friend and colleague, Dr. Francesca Farina. I just want to say that some of the slides have a little bit of formatting issues because of changing desktop and PCs. So my apologies for that as well, but I'm going to stop apologizing and give you a little disclaimer. In this lecture today, I will be talking about issues around brain health, including dementia. I'll also be talking about violence, specifically intimate and domestic partner violence, and I will be talking about some drugs and drug interactions. So if any of those things are triggering, please take all the time you need. You can watch this again some other time. So yeah, I guess we should get started. I'll get early onset dementia as my mom got diagnosed with FTD in her 60s and I'm in my 40s. Buddy, there's things we can talk about with this, and I'll touch on some things here. But if I forget, send another message, send another comment, and bring it back to the front of my attention, because that's something that's an important thing to discuss. And I know a lot of people. I was telling the team before we went live, I must have given 20 or 30 different dementia and brain health lectures around the world. I really care about this topic, and this is why my career is in this area. And people often, and I'm not minimalizing this question that you have, but I'm normalizing it. People want to know about what is their risk of dementia and what they can do to reduce it. And they especially want to know because if they have family members that are living with dementia. So Dementia 101. I don't drive in the UK. I don't have my driver's license there, but I take a lot of Ubers, and all the time when people ask me, what do you do? And if I tell them, they want to know about dementia. So these are just some very basic things. And I made this slide specifically for this presentation. and it says dementia is not a normal part of aging. If there is one fact you can leave, or your mom died in 2013. Thank you, Ju. If there's one fact I can leave everybody with today, it's that dementia is not a normal part of aging. There's so many things we can do in our human lifespans to reduce our risk of dementia. So just hammering that one home, dementia is not a normal part of aging. Someday in our society, we'll be able to have human lifespans without dementia in it. It won't be in our lives, but hopefully in our next generation's lives. Okay, again, I apologize about the formatting here. So what is dementia? Dementia is a set of symptoms that include a loss of concentration and memory problems, mood and behavior changes, and problems with communicating and reasoning. So oftentimes people will think of dementia and it will just be memory. Memory will be the only thing that people will focus on. Memory is just one symptom in a huge basket of symptoms with dementia. So you can see all these different types of dementia on the right-hand side, and many people will already understand this. But there's Alzheimer's disease, which accounts for 62% of cases of dementia. So a huge amount of cases of dementia are Alzheimer's disease. And Alzheimer's disease itself, as the more research we do on the brain, the more we're seeing Alzheimer's disease could be broken up into many, many different other types of dementia. So really, the more we know, the more we're learning about, what is different forms of dementia. So dementia results from a variety of diseases and injuries that primarily affect the brain. So there's many things that will increase your risk of dementia that we're just beginning to learn about. I want to point to dementia with Lewy bodies, because this is something that Lewy body dementia is called the most common form of dementia you may have never heard of. That's what it's called basically in the dementia research area. And my apologies, there seems to be construction. I'm in a hotel room, in a hotel near me, or in a room near me. So yeah, my apologies about any background noise you may hear. So Lewy body dementia is a really interesting one. And how I like to describe it's different than Alzheimer's disease. Alzheimer's disease is very much memory, really a lot of memory impairment issues. With Lewy body dementia, memory isn't the first symptom. The first symptom is often really severe sleep disturbances, and then visual and auditory hallucinations. So hallucinations aren't really something we think about when we talk about dementia in common, or in the public, in the general public. But the brain is incredible, and there's so many different unique symptoms that can be associated with different forms of dementia. So if you're concerned about anything, it's always good to talk to your medical practitioner about what's going on, and they can alleviate any fears for you or put you on a pathway to get the support that you need. Oh, sorry, I'm trying to change slides on my desktop. Again, my apologies for the formatting. So currently there's over 55 million people living with dementia, and 60% of those individuals are from low and middle income countries. Now in Canada, we have 45 million Canadians. So there's more people living with dementia in the world right now than there are actual Canadians. And as the population increases for the world, this number is expected to increase up to 80 million people. And then very soon, by 2050, only 26 more years away, the number will increase to almost 140 million people with dementia. A huge amount of people with dementia. And this isn't just because the population is aging. There's many different factors that are at play here. And I flagged two organizations on the right, the World Health Organization and Alzheimer's Disease International. If you want to Google them and put in the word dementia beside it, they have really good resources for support about brain health and dementia. So dementia in the UK. So specifically, there's lots of people in the UK here. 2/3 of people with dementia live in the community or informal care in the UK. And there's over 500,000 unpaid care partners for people with dementia in England alone. So a huge amount of people living with dementia, and then on the flip side, a huge amount of people caring for somebody living with dementia. And the social and economic impact, just for a second here. So in 2019, it was estimated that the societal cost of dementia was over £1 trillion. And in 2030, just 6 more years, it's expected to surpass to be over £2.2 trillion. And within the UK alone, dementia costs the economy almost 24 billion a year. And that's due to increase to upwards of 60 billion by 2050. And almost 12 billion of that is only from unpaid care. So yes, there's the human cost of dementia, 55 million people with dementia. In 15 years, that number will double. And in 30 years, that number will triple. And then we have the economic cost of dementia, about how it's affecting our economies as well as how it's affecting the humans within the economy. And I know this feels like it could feel like a lot of negative things, but we'll end this conversation on a positive note, I promise. Something that's really important to point out is that women and men are affected by dementia differently. Globally, dementia disproportionately impacts women. Across the world, 65% of total deaths due to dementia are women. Also, disability-adjusted life years for dementia are 60% higher in women than men. So what that means, just putting it into a human conversation now, is if you're a woman, you're more likely to get dementia. If you're a woman, you're more likely to have more difficult years and more disability in your life because of dementia. So the symptoms will impact you greater. And then if you're a woman, you're more likely to be a care partner or a caregiver for somebody more than men. So basically, I look at dementia as a woman's issue. It's everyone's issue, but it is also disproportionately affecting women more than men. So it's something that we really need to be aware of. But there's different issues that affect men and women differently for the brain. So I don't want to say that men are getting off scot-free because of this. That's absolutely not the case. In this beautiful graph from the Women's Brain Project, it outlines the different brain issues for men and women for mental diseases with a sex bias. So on the left-hand side, you can see female-biased brain issues, and on the right side, you can see male-biased brain issues. So on the left side for women are more likely to experience late-onset schizophrenia, anorexia, bulimia, multiple sclerosis, and some forms of dementia. And on the right side, men are more likely to experience ADHD, autism, dyslexia, stuttering, Parkinson's, and midlife stroke, a number of different things. So I say this to say that it is an unequal playing field when it comes to dementia, but there's so many different issues that will happen with the brain that nobody has it particularly easy. So now living with dementia. We went over a bit of dementia 101, and now actually living with dementia. So again, my apologies for the slides. There's some signs and symptoms that could include this. So struggling to remember recent events or things I've seen on TV, difficulty following conversations, losing the thread of a conversation, getting confused in lost or familiar environments, or auditory or visual hallucinations. Now, these are just some of the symptoms. There's so many other symptoms that could potentially be, and not to make anybody stressed or anxious about this. One thing I will say, and I hear this from family members and friends all the time, is that people will wonder if they go into a room and you walk into a room and you're like, oh, why am I in this room right now? That is not a sign of dementia. That's a normal human experience. Every one of us does that. Every one of us loses our keys. Every one of us forgets why we came somewhere, why we opened some drawer. So please don't let that frighten you to make you think I need to go get checked out. That's human and you're okay. If other symptoms happen, I mean, if you're forgetting the names of your best friend often, or the names of your children, then maybe that needs to be looked into. But just forgetting what room you're in, you're mostly okay. So again, my apologies about this slide formatting. This is my dear friend Kate Swaffer. Kate is living with frontotemporal dementia. She was diagnosed in her early or mid 40s, my apologies. And Kate is one of the biggest dementia advocates in the world. She's written a book about her dementia experience titled What the Hell Happened to My Brain? And she also coined the term called prescribed disengagement. And what that is when, let's say I went to the doctors and I was like, look, I'm worried that I'm having some symptoms about dementia. If I got diagnosed with dementia, Kate advocated for this thing that should no longer exist called prescribed disengagement. It's when a physician will say, look, you have dementia, there's no more life left to live, go home and get your affairs in order for the end of life. And what Kate advocated for was rehabilitation for dementia. So one of her issues for her type of dementia is mobility. So instead of just saying, okay, go home and get your affairs in order, she wanted access to physiotherapy to help her be able to walk well. She also wanted access to things like speech and language therapy to help her be able to communicate better. Because depending on what part of the brain the dementia is affecting you, what type of dementia it is, it can then impact those areas for either communication, mobility, relationships, anything like that. So whatever area of the brain is infected with the dementia, it's important to see what type of post-diagnostic support is there for you. So speaking of post-diagnostic support, this is why I originally moved to the UK. And there's a QR code on the right there if you're interested. It's an academic article, so just a heads up that it's not going to be a super fun, I shouldn't say that. It's not the most engaging read. It's a very research-focused read. But what this project is, again, why I originally came to the UK about 4 years ago, was it was looking at what's the post-diagnostic experience for people when they're diagnosed with dementia. So what do they actually receive? What support do they receive? And what do they actually want? It was an amazing study called the PRIDEM study. And it talked to people living with dementia, their care partners, and then professionals who are working with people with dementia, all to look at what do people know about dementia, what kind of support do they want, and how are they accessing that support, or how are they not getting that support that they need. So if you want to know more about that, you can also just Google PRIDEM dementia. Lots of information will come up there. So another thing people always ask is there a cure for dementia? Will there be a cure for dementia? When will pharmaceutical companies develop a cure so that we don't have to have dementia anymore? And these are some of the headlines that I talk about. So will we ever cure dementia? There's the new medication that was rolled out last summer. Aricept has been around for a really long time. And then there's always things in the news about random things that you're like, sorry, what? That's not going to cure dementia. So one article on the BBC a couple years ago was Viagra may be useful against Alzheimer's disease. Honestly, in every conference and every conversation I've had, nobody has ever said this is a possibility, but it made for a great headline for the BBC. And that's all I've ever heard of it. But I just wanted to flag it to say there is no cure for dementia. There is no cure coming down the pipeline just yet. There's a huge amount of researchers and people looking into finding a cure, but right now we don't have one. There's medications that will, for some populations and some forms of dementia, will lessen the symptoms of dementia, whether that's sleep issues or cognitive inability, but there's no cure yet. There are talks about developing a vaccine specifically for Alzheimer's disease, but that again hasn't been developed yet. But I believe we'll be seeing something in that line versus a tablet type of cure in the future. So it's a really, really good space to be looking at and to be aware of the research for. So again, we talked about caregiving. So 30% of carers for people with dementia have been doing so for over 5 and 10 years. So a huge amount of caregiving. So if you're taking care of, let's say, your husband or your wife who's living with dementia, are there any caregivers on the call right now? You can say it with Slido and make that anonymous, or you can say it in the chat if you are. But caregiving in dementia, it's almost like the two sides of a coin. You can't talk about living with dementia without also talking about the care partners of the people and the families living with dementia. Another thing I was going to flag, because the UK has done a really good job of this, is dementia-friendly communities. And these were a big thing about 8, 9, 10 years ago. And what it was training staff, so let's say shop front owners, people in the public, to be able to make them aware of, if you see somebody out who doesn't know, who looks a little bit lost or something like that, what can be done to support them if they're living with dementia. So all these tiny little images you can see there's a lot more now, are all stickers or they're all symbols that people would put in their storefronts. So you can see the red handkerchief there in the middle. That was something that in the Netherlands, that it was basically if somebody had a red handkerchief on the front of their store, if a care partner or somebody living with dementia wasn't sure what to do or they needed a bit of extra support, they could go into that store because people would be trained to support them. In the UK, there's the forget-me-not flower. And a few different countries have that one. Okay, now this is the area that I love all the areas. I love all the areas of research for brain health and dementia, but this is the one that for the last 5 years I've really been focused on, and I'm I'm pretty obsessed. So if you have any specific questions about brain health and dementia, I see there is a couple ones there, and I don't promise to be able to answer them all. I mean, I'm a gerontologist, I'm not a geneticist or a brain imager, but I'll do my best. And if I don't know the answer, I probably know somebody in my circle who will know the answer. Okay, so brain health literature, in the scientific literature, you can see there the huge amount of people that have now all of a sudden, it's such a big and growing area. So you can see on this graph here, different things, different times people quoted brain health in the scientific literature. And thank you to my friend Sarah for this slide, is that in 2011, you can see this huge spike where individuals are now publishing and doing research about brain health. And if they're doing brain health research before, but the term brain health really has gotten a huge amount of attention recently, which is terrific. So you can see this huge boost of people publishing about brain health in the scientific literature. Now, and again, my apologies for the formatting of this slide, and I won't say sorry again about that. But so here for genetics, I'm going to walk you through this slide. So we start on the left with a baby, and you can see that there's different genetic and family genetic risk for dementia. And then as individuals grow, you can see there's preclinical Alzheimer's disease. And what we know is that even as a zygote, even very, very small, you're set up to be a different risk level for dementia. This is given many different things, including the social determinants of health, where you're living in the world, your socioeconomic variability, your family history, what type of food you're eating, all of this stuff impacts your risk of dementia. So it's not just one gene. So even if you do 23andMe or one of those things and you find out that you have a certain gene, that does not mean that you'll get dementia. I know Chris Hemsworth, he found out that he had it, and then he made this big statement of, I'm backing away from acting because I'm at a higher risk for dementia. But I wish somebody would have intervened and said, yeah, buddy, you're at a higher risk, but I mean, lots of people are at a higher risk for dementia. That doesn't mean that you're going to get it. Okay, so back to this graph. So there's also, so here, preclinical Alzheimer's disease, you can see it with the person in the yellow shirt there. So there's structural changes that you can see with an MRI for your brain. And then once you get mild cognitive impairment, that's when you have the symptoms of that people commonly associate with dementia, such as memory loss or confusion. So it's mild cognitive impairment. And then after that, sometimes you can then develop dementia. And with dementia, you see physical changes in the brain. You see cognitive dysfunction, so such as memory or communication, and also functional impairment, such as mobility. So dementia is considered a later stage disease, so that even if people in their 40s, 50s, and 60s, and even in their 30s, dementia would be considered a later stage disease. But the causes of dementia can show themselves 20, 30, 40, 50 years earlier. So midlife is a crucial window to be looking at brain health risks, what's happening with your own brain health, and to say what lifestyle choices should I adopt or let go to increase my own brain health. And we'll talk about that in just a second. So dementia is not a relevant term to consider here. Instead, the maintenance of good brain health and risk reduction are relevant. So I'm in a dementia research center right now at Leeds Beckett University. I probably should have introduced myself there. I'm also a senior Atlantic fellow with the Global Brain Health Institute. So what this means for my work is that I look at dementia and brain health locally as well as internationally. And what we really try to push here is this message of brain health and brain health across the lifespan. So when you talk about dementia, sometimes you see people shut down because they're like, well, dementia happens when you're an older adult. It doesn't affect me. But brain health is something that we all can take autonomy over, and we can all support ourselves by having amazing brain health so that we reduce our risk of dementia. I know there's some comments here, so just give me, I'm going to change slide. This is a beautiful illustration looking at what brain health is. And again, this is something that I describe often. So brain health is your thinking, your emotional, and your physical domains. So it's influenced by your environment, your biology, and your mental health. So I gave a lecture last week in the School of Public Health at Leeds Beckett University, and the lecture was in a series all about mental health. And I had to really talk to the organizer about why brain health should be included in mental health. Brain health is an all-encompassing umbrella. Mental health is one part of it. Neurodiversity, cognition, physical effects of the brain, all of that go under brain health. And the World Health Organization just published their first paper 2 years ago about brain health. So in the next 5 or 10 years, we'll see this concept of brain health get more and more attention in the media. And it will just be something that in regular conversations, we talk about our brain health. Okay, let me go to these comments and see if there's anything here. So it's a genetics question. Helen, I don't know if I can help you with your genetic question. I'm not sure where it was. If somebody could put that back in the... Oh, okay. Yeah, if in the private chat, if you could condense the questions for me, that would be absolutely terrific. So one individual, Michelle, dad was formally diagnosed and prescribed one medication. The memory clinic discharged him and no more contact from anyone. 2 years later, how do we know if he needs more meds? The GP doesn't help either. Oh, buddy, I'm sorry to hear. You know what? This is something that I love about the UK is there's this thing called Admiral nurses. You probably already know about them if your dad has a formal diagnosis, but the Admiral nurses have specific dementia hotlines that are open 24/7. And if they have even one for Lewy body dementia. So if you call the Admiral nurses hotline, they'll be able to walk you through the exact, maybe not wording, but what dialogue you need to have with your physician to be like, look, we need support here. Because maybe it's something that could be explored with Admiral nurse, but if not, they'll be able to help guide you to go forward. And if there's any other questions, please honestly let me know. But I'm going to continue because I worked really hard on this presentation and I want to share it with you guys. Okay, so there's 12 dementia risk factors. So people will also say, remember the very first slide I showed, which is dementia is not a normal part of aging. Dementia is not a normal part of aging. And there's 12 risk factors that will put you at higher risk for dementia earlier in life. Now, if you think about these factors as potential things in your life that maybe you need to increase or decrease. So the 12 of them, and I'll name them out here, are physical inactivity, smoking, vaping is also bad for you, excessive alcohol consumption, air pollution, head injury, education, hypertension, diabetes, depression, hearing impairment, obesity, and infrequent social contact. So these are all the risk factors for dementia. I'm going to show you a really nice image in just a second here. Now, you can see that some of these are just going to happen, right? We might go through periods of our life where we're experiencing social isolation. We may have a traumatic brain injury. We may be living with obesity or living in a bigger body. We may have depression. So in a human lifespan, some of these things, they're going to happen. So what this means is we have to reduce the other things in them. So if you're living with depression, yes, that's a risk factor for dementia, but maybe if you're doing more physical activity, that reduces your risk factors. So all of these things to say that everything is movable and malleable. So even though we know these things increase our risk of dementia, it doesn't mean we'll 100% get them. It's just something to be aware of. And if there's any specific questions about risk factors, you just let me know in the chat about it. Oh, yeah, the Herbert protocol. Very, very good. Thank you, Julie, for putting that in the chat. 100%. So another thing with dementia is, specifically with Alzheimer's disease, people will do wayfinding. So it used to be called wandering, but now the more politically correct term there is wayfinding, that people will look for either exit seeking or they'll have different behaviors to say, I need to be going here, I'm late for this. And so the Herbert protocol, I believe, if I remember correctly in the UK, because we have a different name for it in Canada, is to be able to help people find their way, or I believe so. But yeah, if you Google that, there's lots of different policies and systems put in place to support people's safety living with dementia. Okay, so this slide here, and it's very, very small, so my apologies here. You see how there's a gray snake there? That big gray line is risks unknown. So what that shows us is that 60% of reasons for people getting dementia is unknown. But if you go for the other snake, the green, the blue, the purple, you can see all those little bubbles will tell us what research has shown to put us at greater or lesser increase of dementia. And it starts off from early life to later life. So in early life, we see that if you don't have an education, and this education is specifically being able to read, write, basic mathematics, if you don't have that education, you're at a 7% increased risk of dementia. For midlife, if you have hearing loss, you're at I believe that's a 3% increase for dementia, traumatic brain injury, hypertension, alcohol, obesity, air pollution. All of these things will put you at an increased risk of dementia. And then in later life, we have things like smoking, depression, social isolation, physical activity, air pollution, and diabetes. These will put you at greater risk for dementia if you experience them in later life. Now that was a lot. And I know whenever I do that slide, there's always other questions. If we were together, people would probably ask me about vaping. Vaping does not have good impacts on your brain. It's potentially not as bad as smoking, but it's also not without its risks. Okay, let me just see if there's another question here. Okay, so next slide. In this Dementia Lancet Commission, and you can Google it and find it. Again, it's a massive scientific piece of research, so it's not the most entertaining read, but it's got a lot of good stuff in there. I pulled out one quote that I want to share here today. Sorry, just all the drilling in the background. It's not good. So the one quote that I want to pull out here today is important to remember that more socially disadvantaged groups, including Black, Asian, and ethnic minority groups, are particularly at risk. And I wanted to highlight to say that individuals who are from racialized communities are both at greater risk of dementia, greater risk of not receiving a timely diagnosis, and then a greater risk of not accessing post-diagnostic support or having good post-diagnostic support offered to them. So remember how I said that dementia is a woman's issue? Dementia is also a massive issue for underserved populations in racialized communities. Okay, remember how I said there was 12 different risk factors for dementia? Often when I do this presentation, people will say, what else is coming down the line that could potentially put me at greater risk for dementia? And I know I was talking with some of the people from the Royal Voluntary Society, is head injury is a massive risk factor for dementia. And I know in the news, we've seen different increases for people with rugby and play football with the traumatic brain injury. They'll be at greater risk of dementia, potentially greater risk of dementia. Again, it doesn't mean you'll for sure get dementia. But there's also intimate partner violence. And this is one I fully believe in the next few years, we'll see it come out as a risk factor for dementia. So I want to pull out a quote here that's come from peer-reviewed literature. The number of individuals who have experienced head injury due to domestic violence is 11 to 12 times higher than brain injury due to sports injuries or military service. So in Canada, we have this saying that for every one professional ice hockey player that comes forward with traumatic brain injury that puts them at increased risk of dementia, one professional ice hockey player, there is 10,000 women living with intimate partner violence difficulties and with head trauma because of intimate partner violence that puts them at just as much risk as the ice hockey player for dementia earlier in life. So again, it is a heavy topic, but it's one that we're going to see more and more in the media come forward to say intimate partner violence as well as sports both put people at contact sports can put people at increased risk for head injury, and increased risk of head injury puts you at increased risk of dementia. And I just see a comment there. Helen said, I was concussed at age 12 or 13 and I lost my sense of smell. So this is something that people will, first of all, Helen, if we were together, I'd be like, buddy, you're going to be okay. But also I don't know you, so I can't fully say that. But there's so many people that are walking around with concussions, really serious concussions, really serious head injuries. My own mom is living with a traumatic brain injury. And although that will put them at increased risk at one point, so for my mom, an increased risk of dementia, there's other things that can be done, such as all the other 12 things in that list look to those and see where you can increase your brain health in those. And a lot of them are just common sense public health messages that also associate with brain health. But it could increase your risk, but that doesn't mean that you're going to get it. Okay. And please feel free to ask any more questions. And if there's anything else I can say, because the last thing I want is people leaving this conversation and being more scared about dementia. That's not what we want at all. Education is power, and it will keep us doing good work. Okay, next slide. So brain health research, and this is one of the things. So is it Helen? And there's a few other people in the chat there. Thank you so much for all your comments, everyone. It makes me feel like I'm not by myself yammering on in a hotel room. It makes me feel good. So please ask whatever comments you have. Something that I really care about is getting people involved in brain health research. Scientists cannot figure this out by ourselves. We work in communities and we work in partnership with people within the community. And we're community members ourselves. So we need to make sure that people are aware of brain health research and are involved in brain health research if they choose to be. So one of the projects that I lead is looking at people's experiences in brain health research. And I take that information and I help researchers, including myself, basically do better, more inclusive research. So I work with this really brilliant group called the PREVENT study. And there's the website in the bottom there. And what PREVENT is, it's a 10-year longitudinal study. It's still going, just had its 10-year anniversary a few weeks ago. PREVENT looks at brain health in 40 to 59-year-olds. And oftentimes when we think about dementia, we think of older adults. But here, what they're doing is they're looking for biological changes in the brain that happen before dementia symptoms even come. So they use memory assessment, clinical examinations, MRIs, genetics, lifestyle inventories, personality batteries, all of these things to look at what are the changes in the brain that are happening before somebody has dementia. So what I did was I interviewed several participants in the PREVENT study, and I asked them, why did they get involved in research? What was their experience about being a participant in brain health research? They did things like every PREVENT participant got a lumbar puncture, and they weren't paid to do it. They did it because they just wanted to give back to society. So I talked to participants in this massive study. I asked them, why did you participate? What was your experience? What made it harder or easier to participate? And I talked to people in racialized communities who participated in the PREVENT study and asked them, is there anybody else in your family or your social circle that also participates in brain health research? And overwhelmingly, every participant said, no, I'm the only one I know who participates in research. Now, I have a question for you. The question is, have you ever participated in research? Now, you don't have to, don't feel like you have to post it in the comments. You can if you want, and I'd love to know. But have you ever participated in research? If so, why? If not, why not? This isn't a test. I'm not grading anybody here, but I am interested because there's a real need to get more and more people involved in brain health research. And at the end of this presentation, I'll show you some ways to get involved in it. And it's not my research. Don't worry, I'm not going to try and recruit everyone to be a participant. But it is important that as much as we want science to give to us, we also have to give back and put in time. So the findings from this study. Oh, great. Someone's participated. Great. You've participated through Alzheimer's research. Great. Okay. So there's a big fear of cognitive tests. So individuals, I'm going to show you this image first. People were scared to take a cognitive test. To find out how your cognition is, you have to do a test for it. And the test will often be exhausting and you will not feel smart at the end of the test. But that's important because your brain has to be stretched to the max for us to be able to see the metrics of where you are in your cognition. So participants I'm worried that the test would be too difficult. These are things that they told me. I'm worried that this cognitive test will show me that I'm stupid. I promise you that's not the case. I worry that this test will reveal some things about my health. So even though it's exhausting to do a cognitive test with researchers, anyone who's participated in research, Christina, thank you very much for sharing. Michelle, thank you for sharing as well. No support. Yes. I know, Michelle, that's one of the things, right? And Lorna as well. People aren't aware of research. So people can't get involved if they're not aware of it. So I'm going to, at the end, tell you a really easy way to get involved in research. And it's not just emailing me. You're more than welcome to, but an entire website the UK has set up. It's brilliant. Okay. So people were worried about cognitive tests, that it's going to show that they're not intelligent. That's not the thing. The logistics of participating in research are exhausting. They can be exhausting. And that's on us as researchers. We need to make research more accessible and more convenient for people. So this individual said, I felt I was actually surprisingly exhausted after participating in research. I was really surprised. I was drained, and I needed a wee bit of time just before I could start off driving again. So fair. Participating in research is exhausting. You're giving a lot to the researcher and to the study, and the individual is doing that to try and find something to help better society or reduce people's risk of dementia. So everyone's coming at it from a good place, but it is exhausting, and that can't be said. So logistics participating, it takes a lot of energy. Sometimes you have to physically travel. Sometimes you have caring responsibilities and you can't take time off work, or you can't take time off away from the family. But that's why, as researchers, we need to do a better job of this. Ju, thank you for sharing that as well. But there's lots of ways that you can participate in research without leaving your house. So yeah, so please don't turn that off, that you can't participate. And why did people participate in research? And this, like I said, when I started doing this research, I couldn't believe that all these people were getting lumbar punctures just for research. I'm a researcher and I wouldn't get a lumbar puncture. I mean, I would maybe if a friend was doing a study, but that's terrifying. So people really wanted to give back to society from the goodness of their hearts. They wanted to participate in research to give back to society. And you can see this here, right? People participate because they want to do something for the cause. Oftentimes, dementia in the family, people will, where do you start? What can you do? You can't cure dementia. You can't fully prevent dementia. So what can you do? You can participate in research to help scientists and help the academic and scientific community find ways to best support people living with dementia now, and to reduce your risk and our risk of dementia in the future. Also, participating in research, some individuals said they participate in research just because they find science interesting and they want to learn more about how is it conducted. And they want to do something for the cause. So that's why people participated. Okay, for the next little bit, I'm going to talk about this really cool study that I'm co-leading with a friend, Dr. Francesca Farina, and it's called Next Generation Brain Health. And I want to leave time for questions here. So I might buzz through a couple slides, but we'll see what we can do. So here, this big Lancet image that I showed you before, you see that there's middle or young adulthood in that square that's kind of pulled to the right. And you see how there's no risk factors there. The only one is education. So between the ages of 18 to 39, we don't have research that shows how can individuals reduce their risk of dementia. And this is a really big deal, because not only have we given the next generation of young individuals climate crisis, recession, a number of things that are not so great, we've also haven't given them enough information to help their brain health and reduce their risk of dementia. So this is a billboard from, I believe it's Brain Health Scotland, and it says, your brain amazing, let's keep it that way. And if you look closely, in the purple font in the middle, it says, it just corrected the top line. So the top line is your brain amazing, but our brains are so incredible that they already figured out how to fix that edit there. Your brain is amazing, and all of your brains are amazing. Thank you so much. So whoever put Join Dementia Research in the chat, that's absolutely brilliant. Thank you very much, everyone. That's what I was going to say at the end, but you beat me to it. No, just kidding. That's good. Thank you for sharing it. The more information, the better. So this is the team that I co-lead, and these are all the different universities across Europe and the States looking at next generation brain health. So we're looking at brain health between the ages of 18 to 39. And does anybody, I don't know the ages of the people in the chat, but I imagine everybody in your life, you'll have somebody that you care about that's between the ages of 18 to 39. So this so this entire study is looking at how can we support the brain health in young adult populations. These are some of the individuals that we met together in Amsterdam last year to develop a consensus paper, looking at what are the key issues for reducing your risk of dementia across the lifespan, specifically in young adulthood. So why young adults? Because they're already mobilizing. They already want to get ahead of what's going on with dementia, and they already want to support each other and themselves to have their best brain health possible. So the aims of this study is to understand, how do young adults conceptualize their own brain health? What is the prevalence of known risk factors, such as obesity or smoking, in this demographic? And then we want to identify methods for estimating dementia risk in this group. We've done public involvement work in Africa, Europe, and North America, and Asia. We've conducted focus groups, we've rolled out an international survey, and we are continuously applying for funding to get a cohort study like the PREVENT study up and running, where we follow young adults for decades and look at their brains and look at their lifestyles and see what's happening. So some of the focus groups that we conducted, we did a year and a half ago, and you can see we oversampled for Black individuals in the US and North America, US and Canada. And what we did is we asked them, and I'll show you this slide, it's pretty interesting, it's a live illustration. We asked young adults, what do they know is good for their brain? What do they know is bad for their brain? And what are some things that they're not sure of? So good for their brain, people said things like sleep, hydration, nutrition, safety. And then what's bad for their brain? People said things like, I know alcohol's bad, but I still want to have a drink. And they asked, what's good or what's bad for their brain? People were not sure about things like birth control. Is birth control good or bad for your brain? Lots of times women are on birth control for 20 years. Is it good or bad for your brain? Are mood stabilizers good or bad for your brain? In situations or states or countries where cannabis is legal, young adults asked, is cannabis good or bad for your brain? We want to know the research around that. So a real appetite young people had about what is good and bad for your brain. From this information, and I just want to say, now I'm conducting more focus groups with people in the UK, young adults who play contact sports and young adults who are living with obesity, to ask them, how do they conceptualize their brain health? What do they know about their brain and what do they want to know about it? And from that, developing health-based interventions. From this information and from Inspire Fund Award, I applied for some funding and got a grant to co-develop a satirical roadshow based on the brain health findings. So to take that academic literature that can be kind of dense and not that exciting sometimes, and work with comedians and influencers to develop a roadshow to bring to young adults, to basically give education in a more digestible, fun format. The people I worked with, the 2 individuals there, were absolutely brilliant, and we toured in the fall to 9 different cities in the UK. Yeah, and it was great. So 2 literature reviews that I want to highlight here. Remember how I said young adults wanted to know, is hormones good or bad for your brain? Birth control. We did a systematic review looking at that, and you can scan that QR code and get access to that if you're interested. And we're doing a massive review right now, looking at all the literature and looking at what do we know about brain health risk and dementia risk reduction in young adult population. So taking thousands of articles and picking out everything that has to do with young adults. Is there a link between migraines and dementia or Alzheimer's? And thank you, Helen, for saying it's okay if I don't know. So I'm not an expert in migraines, but I've got a really good friend who is an expert in migraines. And there's also an absolutely brilliant person from the University of Durham who's an expert in migraines and brain health. So if you Google Durham University brain health migraines, her name should come up. And if not, I'm sure you can find me, and I'm sure I can send you the link. But it is a big area, and I wouldn't be able to tell you if there's a link or not, because it hasn't been shown. It hasn't been shown by research to have a link just yet. But because it's a brain health issue, I would imagine that it wouldn't be the healthiest thing for your brain, but that doesn't mean that you're necessarily more at risk. But there is some really good migraine research going out there. Okay, so we did literature reviews, and now we also rolled out a global survey. This survey is translated into 8 different languages. It takes 10 minutes to do. The UK immediately, all the young people contacts in the UK completed the survey. So we don't need any more UK people to complete the survey. If you have colleagues or friends in other countries who could complete it, that'd be terrific. But basically, this short survey asks young adults about their awareness to dementia and brain health risk, their exposure to risk factors, their attitudes towards genetic testing. And I'm going to show you, this is some things we did on TikTok with influencers to get more engagement with young people, because that's what you have to do. And the survey response, so right now we have over 2,500 responses for the survey. You can see all the countries that are represented. And again, we have 8 or 9 different languages happening. And we're trying to get upwards of 5,000 responses so we can have a global representation of what do young adults understand about their brain health and what do they want to know more about their brain health. So really trying to get and engage an entire demographic and generation of individuals. We were in this massive World Alzheimer's Report. If anybody's interested to learn more, this is a pretty big document, about 76 pages, about risk reduction in dementia. You can Google World Alzheimer's Report 2023 or Dementia Risk Reduction World Alzheimer's Report, or maybe someone in the staff can Google it and drop the link in the chat. But this report is huge, and the only part that talked about young adult brain health in the 76 pages was the green highlighted bit right there, and that's myself and Francesca's study. So there's a big gap in understanding what can young adults do to support their brain health. Okay, last slides. So what is being done? And I wanted to leave it on a positive note. Globally, what's being done is the next generation of leaders, the individuals I'm here with today from the Global Brain Health Institute, of which I'm a senior Atlantic fellow with. Some of us are in Cape Town in South Africa right now. Other individuals are in Vietnam. There's people all, thank you very much for posting the report. There's people all over the world who are focused on brain health issues. I have friends that are doing incredible intervention work. So either with genetics, with nutrition, they're working with people living with dementia. So there's a huge surge of people, especially people earlier in their career, going towards dementia and brain health issues and focusing on them and devoting their time for this. Nationally, again, this is why I moved to the UK, amazing centers of excellence for dementia research. There's one in Newcastle where my home is. There's national centers of excellence in the south as well. So these are huge research hubs that focus specifically on dementia-related issues. And locally, there's DEEP. And DEEP is people living with dementia that support each other, and they apply for grants together, they do activities together, they advocate together. They are a powerhouse of people living with dementia. And they really show that you meet one person with dementia, and that's all you meet is one person with dementia. Everybody is different with dementia. So DEEP is incredible. If you know anybody that is living with dementia, they would be somebody to Google and see if you can get involved with or support them. And also Admiral Nurses, which I brought up before. Okay, so what can you do, leaving this on a positive note? Do not be afraid of getting dementia. You can be aware of what's going to happen, what potentially could happen, but don't be afraid. One of my friends, her entire research program is focusing on the fear of dementia. And what she's shown with her research, and this is Dr. Francesca Farina, is that if you are more afraid of dementia, you will then have an increase of certain lifestyle factors that will put you at higher risk of dementia. So don't be afraid of dementia, please, but also do not be idle. Participate in research. Go to Join Dementia Research, sign up, see what you can get involved with. Encourage your friends and family to participate in research. Have a brief conversation at dinner about, hey, I saw this gal, she was talking about research, maybe we should do something. Nobody can stay idle, and as a society and as a community, we're all in this together. We saw the numbers, currently 55 million people with dementia. The number will double in 15 years and triple in 30 years. So really, we're all in this together, and it takes both researchers and individuals with life experience to participate to help find solutions. Okay, questions. I'm so sorry that I talked for forever, but I can stay a little bit later if people like. But if you have any questions, please let me know. And I brought up blueberries because so many times people ask, will blueberries help my brain health? And yes, eating a variety of colored food will help your brain health, but blueberries will not cure dementia. How can I help my aunt who has vascular dementia even though I can't visit her? Is there any other ways that you can communicate with her? Can you write her a card? Can you do anything so that she can feel seen and loved and know that you are a great niece? If you have anything else specific, you can also, if you're worried about her, see if she can have, if it's called a wellness check in the UK, but there's many things you can do. And if you phone the Admiral Nurses line or the Alzheimer's Society and say, this is the situation, I can't visit her, but what can be done? Maybe they can get a volunteer to go visit her, and maybe you can interact with that volunteer. There's lots and lots of options. Um, so from Slido, my mom has had cognitive decline for years and has struggled to get a diagnosis. She's over 80. Cognitive decline for years and has struggled. She's over 80. What would you recommend? I would say 100% call the Admiral Nurses line. But I just want to point out, though, if she's over 80 and she has cognitive decline, then it may not be dementia. So your brain is like any other organ, right? Your liver, your skin, your heart. Over time, our brains naturally, we will see some cognitive issues with our brains, and that's just normal aging. So again, dementia is not a normal part of aging, but some cognitive decline is a normal part of aging. I would definitely recommend either Admiral Nurses Line or the Alzheimer's Society, giving them a call and seeing what you can do. But I would probably go with Admiral Nurses first. Let me just see what the other comments are. Okay, she's cared for by her husband and carers. Okay. How can a doctor believe I might have dementia when I live alone and already have anxiety? Is there a big difference between anxiety as a mental health and anxiety as a dementia symptom? So anxiety as a dementia symptom, it's really interesting that you brought that up, because anxiety and dementia and depression, both, they do go hand in hand. There would be a big difference, but for you to get a dementia diagnosis, and I'm not sure if you're saying here that you are trying to get one or not, there is a difference, because if you're going to get a dementia diagnosis, there's going to be so many other symptoms that take place. Like I said at the beginning, with all the different symptoms that could possibly be there, just having anxiety wouldn't mean a physician will make you more at risk or give you a dementia diagnosis. Okay, if there's no more questions, that's a lot of information. And I believe Victoria was going to put my LinkedIn in the chat, but feel absolutely no pressure to do that. You can also just Google me and I'll be there, and my LinkedIn will come up, or however else that will be there. But thank you so much for being here today and being on this webinar. If there's no other questions, I think I'll just sit here, or maybe I'll exit. My